I'm Kiew from the Department of Pharmacology. So it is my pleasure to introduce to you our speaker for today. He is Professor Tan Choo Hock. Prof. Tan is a medically trained pharmacologist with a special research focus on snake venoms, snakebite, and treatment innovations. He's currently the chair of the Asia-Pacific region of the International Society on Toxinology. Prof. Tan is previously our colleague at the Department of Pharmacology. Early of this year, he has joined the College of Life Science and Medicine, National Tsinghua University, Taiwan, for career advancement. So although currently he's affiliated with Tsinghua University, Prof. Tan has been recently appointed as the adjunct professor of our department in FOM. And he is still very keen to contribute to the academic and research activities of our faculty. Hence, today he will do so by first bringing us a talk entitled From Neglect to Discovery, Emerging New Treatments for the Neglected Tropical Disease of Snakebite and Venom-inspired Drug Discovery. Over to you, Prof. Tan.
Okay, good morning. Thank you very much, Prof. Q, and also from the FOM for the very kind invitation and also the introduction, Prof. Q. So I will go straight to the point. Today, my topics will be on the neglected snake venom proteins, which has been, my research very much been focusing on a lot on the snake venoms and also antivenoms. And as you can see, let's move the slide. Okay, and as you can see, these were some of the work that has been done previously in the Department of the Pharmacology, and I'm still very keen in this aspect, but perhaps with a slight switch of the focus to something maybe more details in terms of the mechanisms and also application. So back to the topics, here I'm showing you this slide basically just to show you that the great complexity of venomous snakes in this part of the world. Now in Asia Pacific alone, there are easily more than 100 species of medically important snakes, with venomous snakes. They all have venoms of different kinds, and this perfectly reflects the evolvability that comes with variations in terms of the venom proteins. And this venom protein variability, of course, has great medical implications in terms of variations of the biological activities that complicates the pathophysiology, the diagnosis, the treatment of snakebite. And on the other side, you have the variations in their epitopes and also antigenicity, which compromises the effectiveness of most clinically available antivenom products in the world. So this is the current status of snakebite envenoming. It is regarded or designated as the priority neglected tropical disease by the WHO, and they have a very big, ambitions to halve the disease burdens by 50%, reduction in the death and disability in 2030. And this, of course, requires a lot of international collaborations and also, budgets and so on, research to look into this aspect. So as how we started our research, at first we simply just wanted to know the venom variation. These snakes are fantastic. They are so diverse, and so they are venoms. So we applied proteomics in the beginning on the venoms. Or of course, from the snake tissues, you can do genomics, transcriptomics, and more of this. This basically provides you the chance to look into the evolution, the gene expression, the structures of the proteins, and also the antigenicity as well as the toxicity of the venoms, and how treatments can be optimized or even innovated. So we have the luxury to do the study on various snakes, and I'm showing you here the series of cobras of the genus Naja. And of course, we have done this also on the other clades of snakes, such as the Asian pit vipers. Now, these are major cobras found in Asia, and they all do cause neurotoxicity, neurotoxic envenoming to different degrees of severity. So as for the cobras from our compilation so far in our database, we have done actually including those African snakes as well, or the African cobras. But here I'm showing you those that are very commonly, found, and they are medically important in Asia. So here, what you see is a genus-wide variation of the major toxins for cobras, which is the neurotoxins. Okay, so we are seeing a genus-wide variation of the neurotoxin phenotypes, where apparently there is a transition from the long-chain neurotoxins, which is about 60 over amino acids, to short neurotoxins, about 60 amino acids, as cobras diversify into the east. So there's an eastward transition of this phenotypic dichotomy that you can see here. And again, this has implication on the venom function, the clinical toxicity, and then the anti-venom production and treatment in Asia. Because especially for short neurotoxins, they are poorly antigenic, and that means they are very difficult to get neutralized by most clinically used anti-venom. So we also extended our series of study to various other neurotoxic snakes, not just only the cobras, but also on the other species on the land and in the sea and so on. So to cut the story in short, we identify the limiting factors that contribute to the inferior antigenicity in the neurotoxins of the different species. And we do a little bit of biochemical work where we identify and then we purify and pull the relevant neurotoxins from the different species, from the different venoms. And then we innovated a special immunogen formula to produce a sort of like a universal antivenom, where you can call it a pan-region, which means it can be used for the greater or a wider geographical utility. And also it is supposed to cover more species, so it's a pan-species kind of neurotoxic antivenom with higher potency and lower rate of adverse effects antivenoms. So this comes with the hope that we can probably overcome the present challenges of antivenom in the world. Mainly the challenges are about the limited supply and also the low efficacy of antivenom, partly due to the very specific nature of antivenom. Now, having sort of answered the neurotoxic envenoming questions, nevertheless, we have to admit, or we will have to acknowledge that the problems of extensive local tissue damage and necrosis, particularly that caused by cobras, remain unresolved, even with the use of large doses of antivenoms. So there are many reasons behind it. It could be the pharmacokinetics, it could be the pharmacological or the pharmacodynamics factors influencing or compromising the effectiveness of antivenoms. Now, we think that this is attributed to the very large amount of cytotoxins or cardiotoxins that is found in the venom of cobras across all the lineages in the world. Which are again, these cytotoxins are variable in terms of their expression level and also the subtypes from species to species. In terms of lethality, if you compare it to the major neurotoxins, of course, the cardiotoxins are less toxic or less lethal, but they have, they are able to cause severe tissue damage, cell death, leading to significant morbidity, and also that comes with a national and economic loss in many countries. So we analyzed the sequences of cardiotoxins from various species, including the three most representative species, i.e. the Malaysian, the equatorial spitting cobra from Malaysia, and then we have the Thai monocular cobra, Naja, and also there's another one from Taiwan, the Taiwan cobra, Naja atra. So we confirm that, they do share conserved regions, but they're also divergent as they evolve and diversify into different ecological niches. And we sort of show that, well, although they have a difference in terms of their structures and so on, but the antivenoms basically are not really useful or effective in neutralizing the local tissue effect. So this prompted us to take a closer look back into the venom composition and also the evolution aspect. So at this point, the result seems to suggest that apart from the cardiotoxins, the high molecular weight proteins in the venoms across different lineages, they do show, or they do have significance, yeah, as to why they are conserved in all the species across the different across the different geographical areas. So these are particularly, of interest to us are the high molecular weight proteins such as the phosphodiesterase, the 5' nucleotidase, and also the L-amino acid oxidases. They are minor proteins in the snake venoms as well. We have found in our snake venom, proteomics and transcriptomics and across all species, but they are obviously of evolutionary necessity. So, for example, like the PD, the phosphodiesterase, and the 5' nucleotidase, they do suggest perturbation to the purinergic signaling, and maybe that is leading to some sort of adenosine dependence effect, and what we have seen in some of the cell death mechanism that is caused by these snake venoms. That if you try to link the cell death that is caused by snake venoms to what you are seeing in the different various diseases, including cancers, diabetes, and so on, then it comes, then there's questions of whether there is a potential role of inhibitors that can be shared, by these diseases, snake bites, and also the other major systemic disease. I think that the answer is probably quite straightforward. It's a yes. It's because if you look into the structures of these high molecular weight proteins like the phosphodiesterase 5' nucleotidase and the L-amino acid oxidases of the snake venoms, why do snake they express this sort of components or proteins into their venoms? Obviously, there's a role there. Yeah? And if you look into the structures and also the sequence, etc., you actually see a high degree of homology between the snake venoms ones and also the vertebrates or the other higher animals, including humans as well. Here, I'd like to show you the other example, since we mentioned about the potential role of inhibitors. So clicks, clicks is another, it is a venomous snake, of course, but it's not cobra. And clicks belongs to the genus Pangarus. So in our series of click venom studies, we have shown that all the click venoms, they contain a lot of phospholipase A2, and this phospholipase A2, there are many types, but one of the specialty of snake venom phospholipase is that they have evolved presynaptic neurotoxic potentials, right? Which means they actually damage the nerve termini, and that actually leads to the disruption or the depletion of the neurotransmitter release and leading to paralysis. And this sort of paralysis is actually anti-venom resistance, because once you have used up the acetylcholine neurotransmitter, basically you will need days to weeks for the nerve to regenerate. And the patient will have to be kept on intubation, for days and weeks even. All right, so back to the clicks is that we have shown the example of the utility of small molecule inhibitors, such as the click here. And this neurotoxic phospholipase A2, as I have mentioned that, being enzyme, it is susceptible to inhibitors. So varispladib is one of the answer to this. And this is a small molecule, a synthetic molecule, which has actually been used for various other conditions such as sepsis, cardiovascular diseases, etc., and also inflammation. So that the indication is not strictly speaking for snake bite and venoming, but you can see there is a potential for drug repurposing, and that is the direction that we are trying to push. So in one of my study is that we have shown that the use of varispladib, even without anti-venom, in vivo and an in vivo model, we have shown that it is effective against the 5 major crick species in Asia. You only found cricks in Asia, by the way, and we have used a representative species all the way from Pakistan and Sri Lanka, India, and then all the way to Malaysia included, Thailand, and to the East Asia, we have the Bangladesh multicentus from Taiwan. So it seems that, these small molecule inhibitors, they do have the potential to be for drug repurposing, and especially for presynaptic or beta neurotoxicity. It can be used as an adjunct treatment and first aid use. We are not trying to push away anti-venom. We still recognize the need of anti-venom, especially for systemic effects. But for things like plates, where the neurotoxicity is of a different mechanism, where it destroys the presynaptic neurotoxic, which means that you will have to use it as fast as possible. And that, in this case, the varispladib has the potential to be developed as an adjunct treatment or even as an emergency use, like a EpiPen kind of concept that the patient can actually be trained, or the paramedics can be trained before the patients receive anti-venom in the hospital. Now, so meanwhile, as we were working on the cricks and venoming, or also the crick venom, there's another approach that came to our collaboration. That is, since we know that the cricks or the bunglers cause presynaptic neurotoxicity, and this is also called treatment resistant, as I have said, because they destroy the presynaptic nerve termini, and you need days to weeks for the restoration of the function. So why not we help to promote the nerve regeneration? So there are plenty of candidates, of course, for people especially working on nerve biology. They can anytime just give you a list of compounds. But in one of our collaboration with the Italian group, we actually found that, there's an agonist of this receptor that actually is helpful. It leads to rapid, more rapid recovery from the peripheral neuroparalysis. And that actually, implicates that or suggests that the mechanical ventilation period can be shortened, and that should come with a parallel decrease of healthcare cost. So if I have time, I will probably just show you also a little bit about the Vipers or Viperidae series that we have from the Southeast Asia aspects. We have done quite a number of genus, and one of the genus that is still very complex and very diverse is the Trimerosaurus, which is now, I think, that's recognized like more than 40 species, all the way from, I don't know, from Komodo Island or whatever, all the way to Himalaya. So they're so complex and so diverse. So there's a lot of things to work on. But we started with a small project. I mean, this is one of my PhD students' work that is comparing the two Trimerosaurus species in between the species in Malaysia and also Thailand, and we have done the standard work as what I have mentioned just now, looking into the venom variation. We look for the common feature where we can make use of the Thai antivenom to cross-neutralize our problem. And then this another series also on another two exotic or enigmatic but problematic Trimerosaurus species in Indonesia and Malaysia. So we also did the standard proteomics all the way to pharmacology. And currently, we are trying to take a bigger picture at the genus-wide kind of approach, where we will look at different subgenera, because these trimerses, they have divided evolutionarily, they actually belongs to different clades, and different subgenera, which means they have different ecological needs, and their venom variations are just different, etc. While keeping some sort of conserved feature. And we can make use of this conserved feature to look for, common ground where we can work for treatment, but at the same time also the rich repertoire, or the rich biological source of these molecules. Many are actually novel molecules with bioactivities that I think we should look into for potential of drug discovery. So this is one of the work we have just recently doing the revision for the manuscript for the pan-genus proteomics, and we also check on the variation in the antivenom response, and subsequently looking into the utility of some small molecule inhibitors. And when it comes to vipers, of course, the complexity of the pathophysiology is much more challenging because it involves hemotoxicities and so on. So we are also working on at the level of coagulants at the moment. So we're looking into the fibrinolytic activities, and we are testing out the different small molecule inhibitors to see how these can sort of overcome the limitation or the weakness of antivenoms in the world. Okay. Now, so having talked about the sort of like the toxic side of the snake venoms, and I'd just like to just also share with you that by looking or by understanding the diversity of the snake venoms, there's also a potential for biomedical application. So for example, because we know the diversity and also the conserved nature of cytotoxins, that we say, then one of my students have actually been able to come up with a diagnostic kit, or I would say more like a biomarker, which is useful for conservation and for cobra. We'll call it a biomarking. So there's a pan-genus immunodetection assay for cobras in these regards. And in the Southeast Asia, another students of mine have actually done and patented a rapid and simple diagnostic kit for the major 4 species in Southeast Asia for syndrome monitoring, which is actually going to be useful for antivenom use, because the way how we propose for antivenom use is to base on the syndrome. So it's a syndromic approach. Then, of course, there are toxin-inspired drug discovery as well, because it's a rich source of molecules. So why not? So since you are cytotoxic, then you would expect some form of properties like anti-cancers, and even we found some China toxins that can actually be useful for analgesic effects, etc. So there are plenty of things to look into it, as anticoagulants, antimicrobial, antiviral, etc., etc. If you are going down the drug discovery pipeline. So in conclusion, I think the way forward is if you're talking about treatment for snakebite and venoming, a very neglected or priority neglected tropical disease, antivenom is a century-old treatment, more than a century actually, and there's still a lot of things to be improved, still a lot of challenges. And the way forward is perhaps we may look into some of these sort of neglected small molecules inhibitors, perhaps combining two. That will be the way forward to improve the snakebite and venoming, and hoping we can catch the boot for reducing the disease burden by 2030, as advocated by the WHO. well, ambitious, but maybe is doable. And on the other side, there's a biomedical applications, potentials where you can look into things like detection, diagnostics, etc., which may be even, useful not just only at the clinical aspect, but also for epidemiology survey and even in some post-mortem cases, And then, of course, last but not least, will be the Venom-inspired drug discovery. So I think that's I hope I have convinced you that the neglected venom proteins, just as neglected as snakebite, they have more research gaps there, and certainly there are opportunities for collaborations, especially on cell biology and biomedical applications. I think in the FOM, Malaya, we have many experts in this regard, and I do look forward to further working with you guys. So with this, I thank you. There are many people to thank here. I just give you a summary here. Thank you very much. And I take any questions if there's any. Thank you very much. Back to you, Prof. Q.
All right, thank you, Prof. Tan. So we open to the floor for questions. Any questions for Prof. Tan? All right, there is one question on two questions. One from Prof. Sarah. Nice talk and thanks, Rick. Nerve regenerations. Has anyone looked at using low-level laser treatment? Or okay, for nerve regenerations, suppose. Yeah.
Okay. I thank you very much, Prof. Shara, for the interesting questions. Laser treatment. Okay, I have to admit that I have no much idea about this, but I think there are some people using phototherapy. A group of my friend in Brazil, they are working on something like that. But laser is probably something related to that in promoting cell or nerve regeneration. Thank you for the idea. I'll probably look up this, and I hope I can answer you the next time we meet.
Right. Another question from someone anonymous. Have you done studies to look at the use of inhibitors in Crick and venomation as adjunct treatment, and how far do you think before any human study will be seen?
Okay, thank you very much for the question. So the use of inhibitors in Crick and venoming it's been done for my group. We have done that at the animal levels, and as far as I know, in some places they're actually starting on on the clinical trial 1, phase 1, I think, right? So there's opportunity for this. I mean, it looks quite promising. And as an adjunct treatment, yeah, as you see, because I think antivenom is still the definitive essential medicines as laid out by the WHO. So human study is not far away because these are drugs with repurposing, potential. So I think it will be realized soon.
Okay. Following to this question, I would like to ask, right? Let's say if we can use inhibitors. Inhibitor that is actually mentioning here, are they small molecules or they are still protein drugs or antibodies?
Yeah, these are basically small molecules. So it has this attractiveness. Hopefully it will be more generic in its spectrum. Because there are some limitations as well of targets, etc., fast elimination and so on. But at least, there's a hope that instead of relying the huge, big, chunky anti-venom antibodies, then we are now offering another perspective of treatment by using a more generic kind of a small molecule inhibitors.
All right, last question from me. It is interesting to explore the use of venom components for other purposes such as anti-cancer or analgesia. But How about the possibility of mass production of these venom components? Do you have any comments on it? Or in simple, is it easy to upscale the production for medical use or clinical use?
If at the preclinical level, of course, sourcing out the venoms is not, it's not practical. So the other the other techniques like recombinant proteins, etc., definitely come in. And once you identify the lead or the certain amino acid sequence, and then it's not difficult to do the mass production for the preclinical side, But if you're talking about the clinical aspects, to pushing it to clinical, that is applied to all drug discovery. From 10,000 molecules, you probably will get one at the end. And I think there are maybe 2 or 3 successful candidates in the market now. And if we take captopril, captopril as an the most successful example, I think there is hope. I hope we can be optimistic on this.
All right. Any more questions from the floor? All right. If not, we thank Prof. Tan for his presentation today.
Thank you very much.
We will end the session today. Thank you.
Thank you. Bye-bye.